Okay, what's up guys? So we'll continue. This is going to be video 4, and this will be a little bit different. We're going to be going through most commons for PANCE prep. So all the most common things that we need to know, and it's going to be in a kind of a pop quiz format. So again, obviously you can see the answers as they're up on the screen, but if you're just listening to it, I'll try to give a few seconds in between stating what the most common thing is and the answer to it, so you can see if you can remember it in your mind. Okay, so we'll get started. So the most common cause of fungal meningitis. So the most common cause of fungal meningitis is Cryptococcus neoformans. So most common cause of fungal meningitis is Cryptococcus neoformans. What is the most common infection in immunocompromised patients, especially HIV? So the most common infection in immunocompromised patients, that's going to be PCP pneumonia. Pneumocystis carinii pneumonia or Pneumocystis jirovecii pneumonia, same thing. Most common infection in immunocompromised patients, that's that PCP pneumonia. What is the most common hereditary bleeding disorder? What is the most common hereditary bleeding disorder? That's going to be von Willebrand's disease. So von Willebrand's disease, most common hereditary bleeding disorder. What's the most common acute leukemia in adults? So what is the most common acute leukemia in adults? So that's going to be AML, acute myeloid leukemia. So AML, and that has what? The Auer rod spots. The Auer rods. So it has Auer rods for AML. And it's also middle-aged. So M stands for middle-aged. And so CML and AML are middle-aged, so about 60 years old, whereas CLL is much older, like over 70, and ALL is, of course, young kids. So again, most common cause of acute leukemia in adults, it's going to be AML. Most common hereditary hypercoagulability disorder, that's going to be factor V Leiden. So most common hereditary hypercoagulability disorder, that's factor V Leiden. So that's different. Factor V Leiden is a hypercoagulability disorder as opposed to hereditary bleeding disorder, which we just said was von Willebrand's. So what's the most common cause of heart failure itself? So the most common cause of heart failure itself, that's going to be, of course, coronary artery disease. So most common cause of heart failure is actually coronary artery disease. What is the most common cause of restrictive cardiomyopathy? So most common cause of restrictive cardiomyopathy, that's going to be amyloidosis. So amyloidosis, do you remember the other causes are IHAS? So I, idiopathic, H, hemochromatosis, A, of course, amyloidosis, and S, sarcoidosis. So those are all causes of restrictive cardiomyopathy, but amyloidosis is the most common cause of restrictive cardiomyopathy. AAA, abdominal aortic aneurysm, most commonly occurs where along the aorta? So AAA most commonly occurs infrarenally, so below the renal arteries bilaterally. So infrarenally it occurs. So the AAA is the most common location. How about an aortic dissection? What is the most common area where aortic dissection occurs? It most commonly occurs in the ascending portion of the aorta. The ascending portion is the most common for the aortic dissection. So it could be ascending, descending, or aortic arch. And remember our Stanford classifications and DeBakey classifications. And if you're having a descending, you can do potentially medical management, but ascending is worse, and you definitely want to do surgery right away. How about the most common predisposing factor to asthma? What is the most common predisposing factor to asthma? And that's, of course, atopy. So the atopic triad, which we mentioned before, allergic rhinitis, asthma, and atopic dermatitis, so that's eczema. That's your atopic triad. And again, the most common predisposing factor to asthma is atopy in general. What is the most common bug in bronchiectasis? So what is the most common bug in bronchiectasis? So that's going to be Pseudomonas aeruginosa. What is the most common cause of hemoptysis overall? So what is the most common cause of hemoptysis overall? That's going to be lung cancer. So lung cancer is the most common cause of hemoptysis. What is the most common organ affected in sarcoidosis? So what is the most common organ affected in sarcoidosis? And that's going to be, of course, the lung. So other organs can be involved. It's a systemic autoimmune disorder, but the most common in sarcoidosis is the lung. And we see those. Hilar infiltrates lymphadenopathy. Hilar lymphadenopathy in sarcoidosis. And remember, Lofgren syndrome, elevated ACE, angiotensin converting enzyme, and lupus pernio as well, erythema nodosum as well, all in sarcoidosis. And again, the most common manifestation is in the lungs. SIADH. SIADH is the most common manifestation of what type of lung cancer? So what type of lung cancer is SIADH a most common manifestation of? And that's going to be small cell lung cancer. So remember small cell lung cancer and those paraneoplastic phenomenon? SIADH is one of those. And remember to differentiate that from squamous cell, which has the pancreas tumor, which is one of its manifestations. So important to differentiate that. So what is the most common cause of mesothelioma due to exposure to what? So mesothelioma is caused most commonly due to exposure of asbestos. So asbestos. And what do we see on chest radiographs for mesothelioma or for asbestosis? We see pleural plaques. So pleural plaques for asbestosis. And also remember, mesothelioma is the most common cause, or is most commonly caused by asbestosis. So what is the most common cause of a transidative pleural effusion? So what is the most common cause of a transidative pleural effusion? That's going to be CHF, congestive heart failure. So CHF is the most common cause of transidative pleural effusion. And what are some other causes of transidative pleural effusion? So some other causes of a transidative pleural effusion could be cirrhosis, because we're losing that albumin. We're not being able to create that albumin, which drives the oncotic pressure. So we're going to have an increase in hydrostatic pressure, and the blood is going to be forced into the lungs, and we're going to have a pleural effusion from that. That'll still be transidative. And of course, nephrotic syndrome, in which we're also losing protein. So proteins help us keep the fluid intravascularly. And if we lose that force, that oncotic force, we're going to have overriding hydrostatic pressure and increase in edema and especially pleural effusions. So CHF, nephrotic, and cirrhosis for transidative. And how about exudative? What's the difference between transidative and exudative pleural effusions? Exudative is most commonly caused by malignancy as well as infection, and that's going to have a Light's criteria of over 0.6 LDH and over 0.5 protein. So use your Light's criteria to determine if it's transidative versus exudative. So what is the most common single cause of death in infants in the first month of life? So what is the most common single cause of death in infants in the first month of life? So that most common cause of single death in infants in the first month of life is going to be ERDS, I guess, infant respiratory distress syndrome, and it could also be hyaline membrane disease as well. So infant respiratory distress syndrome is going to be the most common single cause of death in the first month of life. What's the most common cause of severe refractory hypoxemia? So what is the most common cause of severe refractory hypoxemia? So severe refractory hypoxemia, that's going to be ARDS, acute respiratory distress syndrome. This is hallmark of ARDS, and patients do not respond well to O2, even to 100% O2. So that's ARDS as the most common cause of severe refractory hypoxemia. How about what is the most common cause of pulmonary hypertension? So what is the most common cause of pulmonary hypertension? So it is going to be idiopathic for the most common cause of pulmonary hypertension. The second most, however, is a pulmonary disease itself, and that would be like COPD. So pulmonary hypertension, COPD, you can especially see that in chronic bronchitis, where you're having that right heart strain just getting worse and worse over the years, leading to that pulmonary hypertension. And most common cause of esophagitis. So pretty obvious, most common cause of esophagitis, of course, is GERD, from the recurrent acid reflux damaging the esophagus. So esophagitis, the most common cause, is going to be GERD. Where is the most common location where you'll find a gastronoma? So where is the most common location of a gastronoma? So what is a gastronoma? Like Zollinger-Ellison syndrome would be a gastronoma. So what is the most common location for this? It's going to be in the duodenum, so in the duodenal wall. So gastrinoma's most common location is in the duodenal wall. What is the most common type of gastric cancer itself? So what is the most common type of gastric cancer? That's going to be adenocarcinoma. So adenocarcinoma, most common type of gastric cancer. What are the most common risk factors for gastric cancer? How about that? Smoking, nitrites, nitrate-rich foods like smoked foods. So smoked foods, etc. And alcohol as well. So adenocarcinoma is the most common type of gastric cancer. And of course, we see the METs supraclavicularly. That's for Chow's nodes as well, another high-yield fact. So adenocarcinoma, most common type of gastric cancer. What is the most common type of gallstone? So most common type of gallstone. The most common type of gallstone is cholesterol gallstones. Cholesterol gallstones. What if there are black gallstones? What would you think for that? Black gallstones would be in hemolysis. So if they were having a hemolytic cause of gallstones somehow, you would have black gallstones. And you can also have parasitic gallstones as well. But cholesterol gallstones are the most common type. What is the most common cause of fulminant hepatitis? So what is the most common cause of fulminant hepatitis? Acute liver failure, in essence. That's actually going to be acetaminophen overdose or overuse. So acetaminophen overdose, remember you want to follow your nomogram. So acetaminophen overdose, and what is the antidote for an acetaminophen overdose? The antidote for acetaminophen overdose is going to be N-acetylcysteine, so NAC. So again, most common cause of fulminant hepatitis, that's acute liver failure, that's going to be an acetaminophen overdose. And acetaminophen overdose we can treat with NAC, N-acetylcysteine. So where is the most common cause of pancreatic cancer found? So where on the location of the pancreas are we going to see pancreatic cancer the most commonly found? And that's, of course, going to be the head of the pancreas. It's the largest area, and that's where we're going to find it. So 70% are in the head of the pancreas, pancreatic cancer. And what's that classic physical exam finding that we see in pancreatic cancer? That's the Courvoisier's sign. So Courvoisier's sign is the palpable, painless, distended gallbladder that we see in pancreatic cancer. And again, so CA19-9 also in pancreatic cancer. And pancreatic cancer most commonly found in the head of the pancreas. What is the most common cause of small bowel obstruction? So what is the most common cause of a small bowel obstruction? Most common cause is going to be post-surgical adhesions. So post-surgical adhesions is the most common cause of small bowel obstruction. Most common area of the colon for diverticular disease. So what is the most common area of the colon for diverticular disease? And that's going to be in the sigmoid of the colon, which makes sense. The sigmoid of the colon is the area where it's having the highest pressure. So when we're forcing our stool out, it has to go through that S. The sigmoid means S. So it has to go through that S area to get to the rectum and the anus. And that's a high pressure. It is higher pressure than the right side of the colon or the transverse colon or even the descending colon, for instance. So there's a higher chance that we're going to have outpouchings in that area. So the sigmoid colon is the most common area for diverticular disease. So where does Crohn's disease most often manifest? So where's the most common manifestation of Crohn's disease going to be? And remember, Crohn's disease has those skip lesions, so it can manifest anywhere from the mouth to the anus. But where's the most common location for Crohn's disease? That's going to be in the terminal ileum. So importantly, that's going to be in the terminal ileum. And that's another reason why we get that B12 deficiency potentially in Crohn's, because that's where the intrinsic factor latches onto the B12 and it absorbs it in the terminal ileum. So most common area of Crohn's disease manifestation is the terminal ileum. So also an interesting one is DJI, duodenum, jejunum, and ileum, Dow Jones Industrial. So that's how I remember duodenum, jejunum, and ileum is the last portion of the small intestine. So that's where Crohn's disease manifests. So what are the most common colonic polyps? So what is the most common type of colonic polyps? So the most common type of colonic polyps, these are going to be hyperplastic polyps, and they have a low chance for malignancy. So hyperplastic polyps are the most common colonic polyps, and they have a low chance for malignancy. And do we remember what type of polyps have a high chance for malignancy? So the polyps that have the highest chance for malignancy are going to be villus adenomas. So villus polyps. So villus, villain, makes sense. You know, sounds like it would be bad. So villus polyps are the highest chance for malignancy, but these hyperplastic polyps are a low chance for malignancy, and luckily they are the most common type of colonic polyp. So hernias. Hernia that is more common in women. What is the hernia that is more common in women? So the hernia that is more common in women is a femoral hernia. However, it's important to note, an indirect hernia is still the most common overall in all patients, men and women. However, femoral is more common in women overall. However, if you're asked, you have a female patient and you're asked what is the most common hernia that they likely have, you're still going to pick indirect hernia because indirect is still the most common overall. It's just that, again, to reiterate, that femoral is a little bit more common in females. So female, femoral, easy to remember. What is the most common cause of chronic diarrhea in an AIDS patient? So what is the most common cause of chronic diarrhea in an AIDS patient? That's going to be cryptosporidium. So cryptosporidium is the most common cause of diarrhea, chronic diarrhea in AIDS patients. So interesting one to know. Most commonly fractured bone in children, you can imagine, is the clavicle. So the most commonly fractured bone in children is the clavicle. And in what situation, as another fact, do we need to break the clavicle in order to help the child actually survive? So when do we need to actually break the clavicle for the child to potentially survive? In a shoulder dystocia, potentially. If we can't deliver the shoulder and we can't put them back in, of course, so we need to pull them out and they could end up with Erb's palsy, which is the waiter tip deformity. And that's going to be potentially due to damage to the brachial plexus from a broken clavicle. So sometimes we need to break the clavicle to save the baby. However, in children, I'm not sure if this is including that in the most common, but just know overall clavicle is the most commonly fractured bone in children. Most common type of elbow dislocation. So what is the most common type of elbow dislocation? So the most common type of elbow dislocation is a posterior dislocation. And that makes sense because an anterior dislocation, we would need the whole olecranon to come anteriorly past the coronoid process. And that would be kind of a massive aspect of the bone to come forward, whereas a posterior makes more sense, especially if we're landing in the outstretched hand or we're landing in like a push-up position or something, when the process can kind of just push past the humerus, the distal humerus. So posterior is the most common cause of elbow dislocation. What is the most common cause of knee pain in a young active person? So what is the most common cause of knee pain in a young active person? So we should have specified potentially most common cause of knee pain in a young active child or adolescent. And the answer would be Osgood-Schlatters disease. So that's a tibial apophysitis in which there's recurrent pain with activity across the tibial tuberosity. and that causes recurrent pain. So that's the most common cause of knee pain in younger patients, and typically they can outgrow this. In the rare case, they'll need surgery for that. So Osgood-Schlatter's, most common cause of knee pain in kids and younger active people. So what is the most common ligament affected in an ankle sprain? So the most common ligament affected in the ankle sprain, that's going to be the anterior talofibular ligament, the ATFL. So the ATFL, the anterior talofibular ligament, is the most common ligament affected in the ankle sprain. And what's the most common mechanism of action of an ankle sprain? That's going to be the inversion of the ankle, which would actually damage this lateral ligament. So the ATFL is more lateral on the ankle. So if you're inverting the foot, that's going to put a lot of stress on that, and it could snap or become strained, of course, and that's an ankle sprain. So most common ligament affected in ankle sprain is that ATFL. What is the most common location of herniated discs? So what is the most common location of a herniated disc? Most common location of a herniated disc is going to be L5 to S1. So L5 to S1, when that mobile lumbar spine connects to the relatively fixed sacrum vertebrae. So that's the largest area and the most common that you're going to have, herniated disc from L5 to S1. Most common organism in acute osteomyelitis. So what is the most common organism in acute osteomyelitis? So a little bit needs some specification here. So is it normal or is it a sickle cell patient? In a previous video, we already said what the most common was in a sickle cell patient. And so the most common organism in acute osteomyelitis for a sickle cell patient, that's going to be Salmonella. So Salmonella is important to know for sickle cell osteomyelitis. But otherwise, in normal patients, it's going to be Staph aureus. So Staph aureus otherwise, and in sickle cell again, Salmonella. How about the most common cause of Reiter's or reactive arthritis syndrome? When do we typically see that? Reiter's or reactive arthritis, what's the most common bug or most common infection? Is going to be chlamydia. So chlamydia is the most common predisposing factor to reactive arthritis or Reiter's syndrome. What's the most common cause of blindness in the elderly? So the most common cause of blindness in the elderly, that's going to be macular degeneration. So macular degeneration is going to be the most common cause of blindness in the elderly, and the most common would be actually a dry macular degeneration, in which we see those drusen spots. So the drusen spots, those yellow spots in the retina, that's macular degeneration, that's dry. We can also see in a more rare and more rapidly progressive, we can see that wet macular degeneration that shows neovascularization and rapid degeneration of eyesight. And if we treat those with the VEGF inhibitors, as we went over previously. And so what's the most common cause of a viral conjunctivitis? So a viral conjunctivitis, the most common cause is adenovirus. So adenovirus, most common cause of a viral conjunctivitis. And what's the most common cause on cruise ships of a virus? So most common cause on cruise ships of a virus is going to be norovirus. We can remember that like Norwegian cruise. So cruise ships, norovirus, most common cause. Most common cause of optic neuritis. So what is the most common cause of optic neuritis itself? That's going to be multiple sclerosis. So multiple sclerosis is the most common cause of optic neuritis. And that's going to be most common in women about age 20 to 40. And that's going to be one of the first manifestations of multiple sclerosis as well. So most common cause of optic neuritis, multiple sclerosis. And we'll pause here, and that will be it for this video of most commons, and we'll continue in the next one.